Hi everyone, my name is Souha. I'm a student nurse at McGill University in my second year, and I am working with CIME. And today I'm going to present to you with Noemie, nutrition for babies and breastfeeding mothers. So there's so many benefits for breastfeeding for both the mother and the infant. There are nutritional, social, environmental, economical, and I can go on and on benefits of breastfeeding. I won't be able to go through all of them, but here are some of them. So for the baby, since babies ingest antibodies from their mother's milk, they tend to have a stronger immune system. So breastfeeding decreases the risk of infection. Diseases like a respiratory infection, otitis, gastrointestinal infection, and it is also shown to decrease the risk of other non-infectious diseases like diabetes, asthma, SIDS, which is sudden infant death syndrome, and obesity. It is shown to decrease the risk of allergies as well, increases the cognitive function of the baby. Plus, every mother's milk is different and contains specific nutrients that are specific to her baby's needs. And finally, infants absorb nutrients more with breast milk than formula milk. And the benefits for the mother include breast milk is free, so it is much more cost efficient, effective than formula milk, and it reduces the risk of postpartum hemorrhage. It is easier for mother to return to their initial weight, and it reduces the risk of ovarian and breast cancer. It also has many psychological and emotional benefits. And finally, it helps mother bond with their infants. So there are a few important basic things about breastfeeding. It is recommended to breastfeed for 20 minutes each breast. So the reason is that milk that comes after 10 to 20 minutes, named the hind milk, is richer and denser. With time, the time becomes shorter and the hind milk comes faster. So colostrum comes in a very small quantity and is very dense in nutrients. It's the first source of immunity and nutrients for the baby. For this reason, it is very beneficial to breastfeed your infants within a few hours after the delivery to get that colostrum. Mothers needs to breastfeed their baby 2 to 3 hours during the day and 3 to 4 hours every 3 to 4 hours during the night. So 4 hours is the maximum a baby can go without breastfeeding, usually. And it's recommended to set an alarm to wake up and breastfeed your baby. If it's difficult for you to breastfeed during the night, then you can pump your milk into bottles and give it to your baby during the night. It is also highly recommended to continue breastfeeding up to 2 years with complementary feeding. To be able to know if your baby is having enough nutrients, I recommend you follow this sheet published by the Quebec government. And in the first couple of days, the infant's stomach is only the size of a cherry, as you can see here. So they don't need much. This is why colostrum that comes first is very little, but is very concentrated and dense in nutrients. First day, you would expect, as you can see in this sheet, first day you can expect 1 wet diaper and 1 solid diaper stool. And on the second day, your baby should have 2 wet diapers and 2 solid stool, and you can go on with the days and follow this sheet. So count the number of diapers. How do I know if my baby is hungry or full? So there are cues for infants to let their mother know if they are hungry. The first signs, the early signs, will include eye rolling under the eyelid. You will notice it. Flexed arms and legs with clenched fists and having a rooting reflex. The rooting reflex is a movement toward whatever touches the area around their mouth and attempts to suck on it. So crying, being agitated, and turning red is late cues of hungriness. So it is recommended that mother keep their babies close to them to get used to noticing these early small cues before their babies start crying or turn red. When babies are full, they slow down the sucking motion and they start to look around, to play, and get distracted from breastfeeding. And they look calmer and they usually sleep when they are full. I will go through some of the key needs of babies. So after the delivery in the hospitals, nurses will ask you for your consent to give vitamin K dose to your infants. So the reason is that newborn's liver is still immature and it uses more vitamin K, a lot more than usual and than adults. So, however, there's not enough vitamin K in the breast milk. So, therefore, babies can easily have a vitamin K deficiency, and that can lead to easy bleeding and bruising of the baby. So, we are always surprised at why some people refuse to have their baby get vitamin K. This is why I'm telling you and I'm giving you this piece of information right now in advance, is that it is shown that there's no harm in taking vitamin K for infant, and having an excess of vitamin K is extremely rare in infants, and it is almost non-existent. Vitamin D supplements is also recommended for infants, and they are breastfed if they are breastfed. So breast milk contains all vitamin except vitamin D, which is crucial for calcium absorption. And therefore, adding vitamin D daily to their nutrition is very important, especially in Canada. For women that are unable to breastfeed, there's absolutely no shame in it. There's a healthy and good alternative to breast milk, which is formula milk. It is important to make sure that babies are exclusively either breastfed or formula fed during the first 6 months. It is healthier and more beneficial to feed infant cow milk or soy milk only after the age of 1. The reason is that infants have more difficulty digesting these types of milk. So plus they don't have the nutrients specific to the infant's needs, and they have a higher risk of contamination. So between the age of 1 and 2, it is recommended to avoid low-fat milk and skim milk and whole milk. It recommended to sterilize bottles and bottle nipple in boiling water to reduce the risk of infection. And you can do that. You may sterilize the bottle once you buy it, when the baby is sick, and when the bottle is used by another baby, and if your baby is premature, because the immune system of the baby is weaker. So you can like boil it and sterilize it as often as possible. The importance of burping babies. So most baby infants will swallow air when fed um, from breast or bottle, and need chains to burp after feeding to get rid of that air. If they don't burp, then the air will build up in their stomach and they experience abdominal pain. So if the baby is spitting up, that means that you may need to decrease the amount of feeding and feed smaller amount more frequently. Burping the infant several times during feeding, such as when the infant is sucking slowed down or stops, decrease the amount of spitting. You can help the baby feel better by holding the baby upright for 30 minutes after feeding, and avoid bouncing or placing him on his abdomen as soon as the feeding ended. There are important points that pregnant women should be aware of during pregnancy and breastfeeding. So first, it is important to completely avoid drinking alcohol during pregnancy, since we don't know the quantity that could be safe for the baby development. When breastfeeding, mothers should also avoid drinking alcohol. However, it is acceptable to have 1 to 2 drinks as long as the mother waits 2 to 3 hours before breastfeeding her baby, to make sure that it doesn't transfer to the baby through the milk. The other restriction are the same during pregnancy and during breastfeeding periods. For caffeine, avoid having more than 2 to 3 cups of coffee a day, which is the equivalent of 300 milligrams a day. And don't forget that chocolate and tea contains caffeine, and energy drinks as well. So please be aware of the ingredients and the amount of caffeine in chocolate and tea, and avoid energy drink at all because it contains a lot of caffeines. It is highly recommended for pregnant women and mothers to quit smoking for the sake of their health and their baby's health. And if they can't, then it is important that they smoke outside, cut down the amount of cigarette they smoke in a day, and to not breastfeed after smoking. Unfortunately, infants of smoking parents have greater risk of dying from sudden infant death syndrome, which is an uh, unexpected and sudden death of an infant during their sleep. During the use of for the use of medication, then it really depends on every medication. So I won't be going in depth into that. But if you are taking medication related to chronic disease like asthma, anxiety, diabetes, hypertension, then you should talk to your doctor that prescribed it to you. But for your information, most illness can be treated during pregnancy. If it's over-the-counter medication, then which are medication that you can buy without a prescription at Jean Coutu or Pharmaprix, for example, then you should talk to the pharmacist. They are usually behind the counter in the back of the store. The mother's need during lactation. So the amount of nutrients required depends on how much you breastfeed your baby. The more you breastfeed, the more calories you will need. So extra calories should come from nutritious food. And liquid requirement during pregnancy is high. You will need 3 liters from fluids and plus other fluids from food. So if your baby seems bothered by certain foods, you eat, then stop that food for at least 3 days. And there are no miracle food that will increase your milk supply. There are a few things that you can do to increase milk supply, like you can feed your baby as often and for as long as the baby's wants, and often and offer both breast at each feed. Give the baby only breast milk and avoid using a pacifier, which may reduce the time the baby spends on the breast, especially in the first 3 months of feeding. So the mother's supply will adjust depending on the demands of her baby.
Okay, so for important nutrients during breastfeeding. So if you still have some prenatal vitamins, you should finish them, and then your doctor may prescribe multivitamin containing folic acid if he or she decides it's necessary. If you are vegetarian or vegan, your doctor may require multivitamin containing vitamin B12 containing at least 5 microgram per day. Omega-3 is also required for child brain development, so you should have at least 2 servings of fish per week, or if you're vegetarian, you can get it from algae or vegan omega-3 supplements. Water is also very important during lactation, so you should increase your water intake to 2 to 3 liters per day. And iron is also very important to prevent any anemia and also to provide your baby with the amount needed of iron to synthesize their blood cells. So, what about calcium? So calcium is also important during breastfeeding, and this is why it is recommended to have 3 cups of milk or a milk alternative, such as fortified soy milk, almond beverages, or stuff like that. And calcium is important, especially during your last trimester or between 6 and 9 months of your pregnancy, and during breastfeeding to provide your baby with calcium needed to support bone and teeth formation. If you're not consuming enough calcium, you will tend to use more calcium from your bone, which will make you lose bone mass. You can see it in the picture on the side. Some orange juice may have calcium fortified in them, and this is good because orange juice naturally contains vitamin C, and so it will improve your calcium absorption to have this vitamin C as well. So if you want to lose, what about if you want to lose pregnancy weight? So sometimes we feel pressured to lose our pregnancy weight and we want to lose the weight as soon as possible. I just want to remind you that through your breastfeeding alone, you are losing weight, and it is important to take this process slowly and not to try to limit any nutritious food, as it will affect the quality and amount of your milk. But here are a few strategies if you want to lose weight. So you should eat early when you feel hungry, including more vegetables and fruits into your diet, which can provide you with nutrients and also help you control your hunger. After delivery, and as soon as your doctor recommends it, you can start to exercise again. Finally, sometimes having enough sleep could also be a way of losing weight. and it can be difficult with the responsibility of a new baby, but try to sleep whenever the baby sleeps so that you can get as much sleep as possible. And finally, drink plenty of water and favor that to other sweetened or caffeinated beverages, which can add calories without providing any nutrients. So to lose the weight you really want to eat when you're hungry, but with nutritious food. So we'll just like recap a bit what we saw. So as we said, iron has a role in the baby's blood production, and you can find iron in fortified cereals and beans. For exercise, so for calcium, the role is in the baby's skeleton development and also in their teeth development, and you can find it in milk and fortified beverages. For omega-3, it has a role in the baby's brain development, and you can find it in fish, fortified eggs, algae, or supplements. For vitamin B12, it has a role both in the baby's blood production and in the baby's brain development. And you can find it in animal sources food, and if you are vegetarian or vegan, you can find it in supplements. And finally, for folate, it has a role in the baby's blood production, and you can find it in green vegetables, cooked legumes, fortified products, and supplements. So an example of breastfeeding with a vegan diet. So for breakfast, you could have half a cup of oatmeal, a quarter cup of walnuts, 1 orange, and 1 cup of soy milk fortified with calcium, B12, and vitamin D. For the morning snack, you could get 5 whole wheat crackers and half a cup of peaches. For lunch, you could have 2 slices of whole wheat bread, 2 tablespoons of peanut butter, 1 miniature box of raisins, 2 large stalks of celery, 15 tortilla chips, 2 tablespoons of salsa, and 1 cup of soy milk fortified with calcium, vitamin B12, and vitamin D. For your afternoon snack, you could get an apple and a quarter cup of almonds. For dinner, you could get a 3/4 cup of tofu, 1 cup of rice noodles, half a cup of cooked spinach, half a cup of cooked broccoli, and half a cup of marinara sauce. And for the evening snack, you could take 2 graham cracker squares with 1 cup of soy milk fortified with calcium, vitamin B12, and vitamin D. So now we'll do an exercise about what are the number of servings for fruits. So for breakfast, we had 1 orange. For the morning snack, we had our half a cup of peaches. For lunch, we have our little box of raisins. And during the afternoon snack, we had our apple. For the vegetables, so during lunch, we had the salsa, and we also had the 2 stalks of celery, and during dinner we had the spinach, the broccoli, and the marinara sauce. For meats and alternatives, so during breakfast we had our a quarter cup of walnuts. During lunch we had our 2 tablespoons of peanut butter. During the afternoon snacks we had our almonds, and during dinner we had our tofu. For the dairy or alternatives, so during breakfast we had our cup of soy milk fortified with calcium, vitamin D, and B12. Same thing for lunch, and same thing for the evening snack. And for the grains, during breakfast we had our half a cup of oatmeal. During the morning snack we had our 5 whole wheat crackers. During lunch we had our 2 slices of whole wheat bread. We also had our 15 tortilla chips. During dinner, we had our rice noodles, and during the evening snacks, we had our graham crackers. So, in summary, you will need around 8 ounces or 240 grams of grains during breastfeeding. You should choose at least half of your grains as whole grain to provide you with fiber, which will also be important for your bowel movement and will make you feel fuller for longer, which can also help with the weight loss. You should choose 3 cups or more of vegetable and fruits. You can, of course, eat more of it. Also focus on variety of colors, and also always favor whole fruits or whole vegetables instead of juices. Milk an alternative, so you should drink 3 cups per day to provide you with adequate amount of calcium and vitamin D, and could give you also fluid that you will need during breastfeeding. And finally, you should choose 6 to 7 ounces of protein. So this could be from meat or legumes like chickpea, beans, lentils, or peanut butter or tofu, as we saw in the example above. This is important to provide you with the protein you need and also to provide you with enough iron.
So now I'm going to do a little quiz, and you can stop and answer it, try to answer it yourself without seeing the answer, but I'm going to give the answer. So you stop the video if you want. But the question is, I need to give my baby vitamin D supplements if formula fed. True or false? The answer is false. Almost all formula milk have vitamin D, and vitamin D is very beneficial for baby that are breastfed, since it's one of the few nutrients that are lacking in breast milk. Our usual source of vitamin D is sun. However, in Canada, being exposed to sun is very difficult, and even in summer, exposing baby to the sun can be dangerous for their skin. So babies are usually lacking in vitamin D. Second question is, how long should a baby be fed at a time from both breasts? You can stop and try to guess it yourself. I mentioned it before, but the answer is 2, since it's 40 minutes. So since the changing composition of the milk from foremilk to hind milk take 10 to 20 minutes, it's important to breastfeed long enough for the supply for the hind milk to come. So otherwise, baby may not get the chance to receive the nutrition from the hind milk. So for both breastfeeding for 40 minutes is optimal. And with time, this time becomes shorter and hind milk will come faster. Last question is, which one of these signs is a late sign of hungriness? The answer is crying, being agitated, and turning red is a late cue of hungriness. Early signs will include eye rolling under the eyelids, flexed arms and legs, and having the rooting reflex. I mentioned earlier, you can go back on that slide and see it yourself. So here are few points that you can take away with you. They're like a summary of this presentation, and yeah, you can read it yourself. And I hope you liked that presentation, and thank you for listening.